Many people worry about what other people think of them, but some people have a deep fear of social situations that might cause embarrassment. For them, occasions such as attending parties or meetings, eating in front of others, having conversations with others, or public speaking can trigger intense discomfort. People who experience this fear often try to avoid these types of situations and view their fears as a social problem or as shyness. However, intense anxiety in social situations can be a hallmark symptom of social anxiety disorder, or SAD, also known as social phobia.
Social anxiety disorder can be very serious. It can hold people back in their work lives, causing them to avoid work opportunities that might involve social interaction that they're afraid of. It can devastate their social lives. People may completely avoid dating situations or feel limited to a very small circle of friends because of fears of social interactions. And over the years, it can take its toll. People go on to develop depression because of these problems. They may turn to alcohol or drugs to try to self-medicate their anxiety.
SAD affects approximately 15 million American adults each year, making it one of the most common psychiatric disorders in the U.S. Dr. Franklin Schneier has treated a number of people with social anxiety disorder at the New York State Psychiatric Institute in New York City. He says SAD can develop in several ways.
People may be born with a genetic inborn tendency towards shyness that some people grow out of, but for others it develops into a worse problem over the years and becomes a full-blown disorder. Also, life experiences can be a factor, so that someone may have certain embarrassing experiences that create fear of new situations, that cause avoidance, and create a spiraling effect of increased anxiety and fear. And of course, both genetics and life experiences can combine for some people to cause problems.
SAD not only keeps people from enjoying being around others, it also affects many aspects of daily life.
Over the years, adolescence is the time where social anxiety tends to really come out. And at that point, as kids are becoming more comfortable with ideas of dating, forming social groups, kids with social anxiety disorder can feel very isolated and they can kind of fall behind in their social development compared to other kids. In the whole work sphere, people with social anxiety may have difficulty going for a job interview. Their whole career opportunities may be shaped by their social fears, so they may have an interest in doing a job that involves social meetings and activities, but end up kind of constricting their dreams.
Before coming to Dr. Franklin Schneier for help, Bob Mazziotti suffered from social anxiety disorder, and he says it caused a number of problems in his life.
As you can expect, there were the social issues, I just avoid all contact and so on. And educational areas so that I wouldn't pursue degrees, business opportunities that I would avoid. And the social anxiety actually, I believe, caused a serious depression for me. And that was the first issue I actually had to deal with.
Studies suggest that social anxiety disorder is more common in women than in men. It also appears to run in families. However, it is important to note that just because someone is shy, it doesn't necessarily mean that they have the disorder.
So there's a wide range of normal personality traits, ranging from being very sociable and extroverted to being on the shy side or inhibited. Now, normal personality traits, though, aren't associated with severe impairment. They may have some advantages or disadvantages, but social anxiety disorder, on the other hand, is by definition accompanied by significant distress or real impairment in functioning in the work world or one's social life. So social anxiety disorder, unlike normal personality traits, is accompanied by impairment or distress.
The symptoms of SAD fall into three categories: physical symptoms such as sweating, blushing, or trembling, cognitive symptoms such as feeling self-conscious or fearing criticism, and avoidance symptoms where someone might avoid social gatherings, interactions with others, or social activities.
And avoidance tends to be the most impairing piece of the problem for social anxiety disorder patients, because by avoiding things they miss out on opportunities to disprove some of those fears of catastrophes, and they also miss out on opportunities to develop their social skills and get more comfortable in those things that they're avoiding.
Though there are perhaps many causes of SAD, one that's shown up in recent research is that certain areas of the brain that we know are sensitive to fear and danger are hyperactive in people with SAD in response to minor social cues.
Tied in with this is the way people think about situations, so that people with social anxiety disorder tend to exaggerate the fear of certain minor social dangers. Someone who's about to give a speech, instead of focusing on the work that they have, the ideas that they want to get across, will instead be focusing on the idea that they're being scrutinized and the idea that they're feeling certain physical symptoms that other people may become aware of. And all this self-consciousness, of course, defeats the purpose of trying to get across their point. As a result, they may have difficulty focusing their attention and actually not perform up to par.
Though persons with social anxiety disorder often view their problem as chronic and hopeless, there are several effective therapies used to treat SAD.
There are two main treatments for social anxiety disorder. One is cognitive behavioral therapy, which is a short-term therapy that helps people to identify where their thoughts may be getting into trouble and to learn some ways to develop other coping strategies for when they're in their feared situation. This is coupled with then entering those feared situations in a gradual, increasing way to gain mastery over them and get their confidence back. The other main approach are medications, and there's several classes of medications that seem to work on the areas of the brain that control anxiety, turning down the volume of that anxiety signal and letting people feel more comfort and success in those situations.
The social anxiety disorder that I had was treated with cognitive behavioral therapy. And those are thoughts that you build up that divert you from doing what you want because you get anxious. But the thoughts aren't really based in reality. They're, just images that you've put together in your mind. So I get with the doctor, we would discuss those thoughts, and we would see, and I would see, how unreasonable they were. When we were done, I had a set of tools that I could take forward with me, a technique. I knew it worked. I'd seen it work in my own life, so I was convinced that it worked. And with that, that gave me a great sense of confidence that if there's a situation, I back up a little bit, I apply the techniques that I learned, and then I approach it again with a sense that, I can probably deal with this. So I think it was terrific.
There's several considerations in determining what is the best treatment for any one person with social anxiety disorder. Sometimes patients have strong preferences for medication or therapy. Medication has the advantage of working relatively quickly, which may be important in some instances. Cognitive behavioral therapy, on the other hand, may have longer lasting benefits so that even after therapy is completed, patients can continue to use the techniques in an ongoing way. And sometimes the combination of medicine and therapy can be most useful.
Social anxiety disorder is common and impairing and responsive to treatment. Most individuals who seek treatment for SAD and other anxiety disorders see significant improvement and enjoy a better life. For more information, visit the Anxiety Disorders Association of America website at adaa.org.